Good evening, everyone. Welcome to the Manas, the Academy of Psychology. I myself, Dr. Narayana, Professor of Psychology, working in Aditya Anna University, Rajamahendravaram. And we started Manas in the year 2020 with the motto of providing knowledge and good information to the needy people, especially the knowledge related to psychology and allied fields. So, from inception of Manas, we have conducted more than 50 online courses and more than 50 workshops and other training programs through online and offline. And the Manas is located in Andhra Pradesh, Rajahmundry. So we do conduct different kinds of programs through online mostly. And in that, one of our unique program is, and we proudly say that this is the program uh, which is offered by Manas first time in India, and the only institute which is offering this course in India. The course is infertility counseling. So this course we initially thought to design that to help people, those who are working in IVF centers, especially counseling psychologists or maybe clinical psychologists. And this course designed by Dr. Pushpa and myself, we have, we have took almost more than a month to complete the course syllabi and all. And we have prepared a curriculum and how to go on and all these things. And this is the course, as I said, which is unique in nature and in content also. So we provide a complete information of IVF and other related procedures. And according to that, she also provide details of how to handle the real-time cases. So this program, we successfully completed 5 courses, 5 batches on the same program, IVF counseling. And this is the 6th batch. So heart, I welcome you all for this wonderful course. And this is a great opportunity to learn about IVF and um, counseling related issues from the Dr. Pushpa. Now, this is briefly about the Manas and this course. And now Dr. Pushpa will explain everything. Before that, I wanted to introduce Dr. Pushpa to you. Dr. Pushpa is a counseling psychologist. She is serving uh, from last 18 years in the field of psychology. And initially, she worked as a counseling psychologist. Later, she turned up as a infertility counselor, and still from last 18 years, still she is continuing in the same area, as well as she is also a practitioner of um, uh, other related specializations like couple counseling or maybe family counseling and all. And she is the founder of um, sorry, I distracted Pushpa.
Sorry, open up with
She is the founder of Open Up with Pushpa, and this is her new venture, and she is serving to the people through this new clinic. And she is from Hyderabad, basically, and from her experience, she used to discuss various cases live cases, and uh, how to deal with the clients or patients in the real time situations, and everything will be discussed by her. And she is very experienced counselor, and I mean as a psychologist, and as well as yeah. So as well as she is a good human being also. She is a friend of mine, my classmate, and we both studied in Andhra University in 2005 and 7. And from onwards, we have start practicing psychology. And I came to the academics, and she came to the uh, application method. Like she's starting counseling from um, 2007 to till the date. And now I welcome Pushpa to start the course, and she will explain everything, and she will also interact with you, and she will introduce herself, and she will interact with you. Welcome, Pushpa.
Thank you. Thank you so much. Hi, all. I want to know a little bit about you. I mean, నా గురించి already everybody got to know. So I want to know which language all of you are comfortable, first thing. Second thing, I want to know each one of you because I should at least know whom I'm teaching, right?
You can continue.
Yeah. So things that you need for this training program, one, be punctual, be on time because I want you people to interact a lot of questions. So when you keep asking, there'll be very limited time. I'm very specific to my own timings. So we will start on time, we'll end on time. So be here on time. Your attendance is mandatory if you want a certificate. Next thing, make sure you have a good system like a computer or a mobile where you're going to connect this. And always have a notepad and pen with you. If there's something, we will always keep sharing you the recorded videos. But at the same time, if there is something that you wanted to make a note or something like that, you can always um, have a notepad with you so that you can write it down. And if you have some questions to ask, you can always write it down. And once I stop this class, you can always ask me questions. Even if you stop me in between and ask the questions, I still have a lot of patience in that. You can ask me. And good internet, make sure you have internet because that's one of the main concern because we are doing it online. And commitment to attend the class, that is very, very important. So stay committed. Okay. And expectations, I think most of us, we already spoke. So this is going to be a 30 hours theory class, and we'll have a lot of in-depth training as well. We'll do practical approach. I'll teach you on how to handle cases, if somebody is going through stress, how to handle them. Different scenarios, we will talk about all that. And we will also teach you how to practice counseling, or how to practice good listening. And if you do well, you will also get a performance certificate from Manas. More than me, I think about all this, Manas is very strict about the timings and all. Even I want to have audience, so please join on time. And yeah, I hope you would get this performance award as well. So your responsibilities is you will have only 2 days in a week class. It's only 1 hour ka class. So make sure you have enough attendance. If in case any time because of the work you're not able to, or because of the internet connection you're not able to, please inform people in Manas and try to listen to the classes again. And it'll be like Tuesday and Thursday every time, like 7:30 to 8:30. And whatever assignments I give you, I'll keep giving you assignments. I want you to finish the assignments and keep uploading it. Uh, Assignments are not going to be too hectic. You can always do them. It's going to be simple, easy ones, but you will learn about it. Okay. And any doubts, I generally ask you to do it at the end, but then so that's my style of teaching. So I generally keep asking you in between if you have any doubts, and then I would always correct that. And whatever reading materials we give, go through it. If there are any questions, you can always drop it in the WhatsApp group also. If you're studying and you have some doubts on it, you can always check in WhatsApp group as well. And see, when you're going through this course, mainly anything on psychological courses, uh, everybody has a different view, everybody has different perception. What is important is to respect each other's opinion. I might have one opinion, somebody else might have another opinion, and there is no right and wrong in the opinions we have. So I want you all to respect the opinion of other person. Don't interrupt the person who is talking, and respect that. And you can always tell your view as well, but respect others' opinion for sure. And please cooperate with management, which is Manas. And yeah, listen well and learn for the future. And yeah, this is something that I want you to know, like what all I'll be covering in this course, because this is the first course that we are basically doing. I mean, like the first class of this course. So at least you should know what you're gonna get. So first thing we'll be talking is about the basic infertility, because not many people are coming from the infertility background. So the basic infertility, I would be talking about the science behind this, the male infertility, male reproductive system, female reproductive system, and psychology behind the infertility treatment that people are going through, and being diagnosed with infertility, how would anybody feel, and how counseling can help infertility patients to overcome and get pregnancy positive faster, and who needs this counseling, the role, how much a clinician, like the doctors or the staff in the hospital, should play in the role of helping the counselors to uh, get into the picture, and what will be the expectations from the management, and how do you handle that expectations if you're working in a fertility center. Then I'll talk about all the ART procedures, like the ovulation induction, IUI, IVF, ICSI, TISA, PGS, PGT. We'll talk about every medical procedures, because if you want to counsel somebody with an infertility problem, you need to know everything medically, only because when a client wants to talk to you, they're not gonna they're not gonna come and talk only about their emotions. All the emotions are linked with the medical aspects. So you basically have to have a proper clear idea about those things. So I'll talk about all the ART procedures. Then we'll talk about how clients go through, what kind of feelings they'll have while they're going through ART procedures, and the impact of relationship between each person, like when they are going through an infertility treatment, how it is it going to impact on the relationships, and how to prevent that, how to help them to overcome that, and gender differences when they're handling infertility, and psychosocial evaluation, like what kind of details you are supposed to take from them, what kind of questions you should ask to make them vent out their emotions and make them feel the psychological blockage which that might come for them, which might also be the reason why pregnancy is happening, how to remove that blockage. So and psychotherapy, like any therapies that we want to do when it comes to infertility. So what kind of therapies will be there? Individual counseling, how do we do? And couple counseling, like if two couples are coming for the counseling, how do you handle it? Support groups, if you want to start a support group, how will you handle that? Sexual counseling, like mainly with infertility, you might have a lot of clients coming for with sexual problems. It can be either a specific sexual problem, or because of this infertility treatment, and it is all time bound, like the ovulation happens only 24 hours, you have only 24 hours, and you the everybody puts force ki, no, this is the time you're supposed to have an intercourse, and that stress keeps increasing for them. So the timed intercourse, so sexual problems are very sensitive topics, so we have to help them to overcome those topics and talk about it. And counseling for pregnancy loss, like if there's any pregnancy loss, miscarriages that happens, how do you support them, how to be available for them. And during counseling, like during the treatment, there are chances of multiple pregnancies, like few people might have like triplets, twins and stuff. So if they have multiple pregnancy, obviously their anxiety or stress levels will keep increasing. So how do you handle if they have multiple pregnancy? And if they have to go for a third party reproduction, like going for a donor egg, donor sperm, or going with a surrogacy. So if they're going for, or if they want to plan even not to have a baby and go for an adoption, or leaving, taking a decision of not having a child at all. As a psychologist, you cannot force them. As a counselor, you cannot force them to take on any decisions. So how do you respect that, and how do you let them look at the consequences that they'll be going through, and help them with whatever decision that they have taken? So how do we handle that? And if somebody wants to end the treatment completely, and they're like, I'm tired of this treatment, I can't take this treatment, I want to end it. So they'll be going through some grief, like, how do I come out of this? How, if in case somebody asks me in society later, how do I handle this? So we'll talk about how to help them in ending the treatment. And we'll also talk about pregnancy after infertility, because like we already discussed, I think, who was that? I think Kamini. So we spoke about this, right? So pregnancy after infertility is one of the very important factors. So we'll cover that as well, like, because every second it is like an anxiety to complete that 9 months, worrying about a miscarriage, or any small deviation which doctor tells you in the scan gives a lot of stress. So we will talk about that, and parenting after infertility, once they're pregnant and they have delivered a baby, with so much of anxiety, with so much of tough journey that they have gone through. Suddenly they have a baby in their hand, and they would try to give their best to the child, and child might take advantage of it in the future. The parenting becomes very tough at one point of time. Initially it won't be a problem. Probably they'll be showing too much love, but how do they balance it? How do they take care of parenting? That also will cover. Probably I will not be able to cover too much of it, but to some extent we'll just touch that. And if there's any other doubts, we can always talk about it. Okay, and we will also talk about how ART treatments impact on the child, on the psychological aspects and also the medical aspects. All this we'll be covering while discussing the whole entire course. Okay, so and I am not a person who would just go with the PPT. I would just be talking about every experiences which I have seen from the last 18 years. I'd be talking about all that. So don't skip the classes, because most of the time it is not just the PPT that we talk. PPT is just the outer structure, outer sketch that we speak about. Okay, and the legal and ethical aspects of counseling. I think this is one thing which is very, very important. Uh, there are a lot of ethical and legal aspects which you need to follow, but people don't really follow. So I want you to learn what are the legal and ethical aspects when you're going for counseling, mainly in infertility. Like, that is one thing that I want to do. And if there are couples who come to you for counseling, like lesbians or single women who wanted to come for ART counseling, how do you tackle them and how do you help them? And yeah, we will be doing a lot of case studies. Okay, so this is what the course module is gonna be. If in case there is anything else that you want me to add, you can always ask me questions during the session, and we can talk about it during the session. Like, you can always ask me questions. Make a note if there is something else that you want me to address. We can definitely do that. Okay, so that's all for today. If there's anything else that you want to add, we can. If not, we can wind up today, and we'll start the real course on Thursday.
There is a question, through this course, can I write ART exam by Kavita?
ART exam. What exam?
Yeah, as if by writing this ART exam, will I be a qualified a fertility counselor? Just I wanted to
Can
understand
be.
that
See,
because
you're already a psychologist,
yeah,
and if you specialize in this, you're eligible to do it.
but what is the procedure for that?
So you'll not have any ART exam as such.
Okay,
I asked you
but
what
the
is it.
certificate itself is enough, right?
So yeah, the certificate is enough. Once you have the certificate, you can go apply for jobs.
Oh,
Yeah,
okay, yeah,
you don't have any exam. So exam is what we conduct here to give you certificate.
okay, fine,
So it will not be like theoretical exam as such, but it will be more of a more of a Viva class. So I'll give
sure.
you. I want you to come up with your own answers on how are you gonna.
Okay. Yeah.